So just explain a bit of the nuts and bolts of how this trial was done, how long it lasted and how you carried it out.
We've been planning the trial for about a year now, and we've carried out a pilot study whereby we had a few items made by local manufacturers, and we had these installed on the ward. And the first question we asked was, if, for example, we had a pair of taps put onto a sink, would this reduce down the numbers of organisms present in that environment? So we carried out a pilot study using various items made out of copper, and we demonstrated that there was a reduction. And this meant to us that it was worthwhile continuing to do a proper controlled study to see whether or not copper actually would continue to have this activity over a period of time. So what we then planned was to do what we call a crossover study. This is a study whereby you have items made of copper and you compare them to items which are made of standard product. So, for example, it could be a chrome-plated tap, it could be a push plate made out of plastic or aluminium, or it could be a grab rail made out of chrome again. So what we did was we compared copper items to non-copper items on a busy medical ward. And after a period of time, 5 weeks, we then changed the items around. So the copper was changed to the chrome, the copper push plates were changed to the plastic push plates, etc. And what we did was we sampled these areas every week, twice during one particular day, first thing in the morning at 7 a.m, before any cleaning took place on the ward, regular cleaning, after the overnight period. And then after a busy day, we sampled again at 5, 6 o'clock at night to see whether or not there's a change in the numbers of organisms on these surfaces. The sampling which we took included taking swabs, and this is what we use on swabbing patients, for example, when we're swabbing wounds, etc. We use the same technology. So we swabbed these surfaces, a defined area, and the swabs were then put into various what we call culture media to grow the organisms. And in fact we used a whole array of culture media. We used up to 7 different media to identify any bacteria and fungi which may have been present on those surfaces related to either the copper items or the non-copper items. We then counted the numbers of organisms present on those surfaces and compared the copper versus non-copper. We did this over a 10-week period, so 5 weeks before we changed over. And the reason why we changed over is to overcome what we call bias. It may be, for example, that one sink is used more frequently than another sink. One toilet is used more frequently than another toilet. So by doing this, a unique crossover study, we are able to take out that bias and to assure ourselves if there was an effect, we would actually determine it by this study. We looked at the results and we analysed the results after the 10-week period, and we carried out statistical analysis on the results, which included the numbers of organisms per unit area of each of the devices. And then we applied conventional statistical analysis to ask the question, was there any difference between the two samples, and was it significant? And the results which we're presenting in America next week at the International Congress of Antimicrobial Agents Chemotherapy, probably the premier worldwide meeting on infectious diseases microbiology, that we will be telling individuals at that meeting, over 10,000 people attending, we'll be telling the audience that the copper resulted in a significant reduction in the numbers of organisms on those surfaces compared to the standard product. And this was despite absolute scrupulous cleaning on the ward. Now, the reason why we get organisms on surfaces, and you cannot keep surfaces completely sterile all the time, is because we're touching them. We've got environmental contamination, and everybody realises that. But the copper, I would suggest, it has appeared to be what we call an intelligent metal, whereby it's augmenting already good cleaning processes. And the results are the first time I've ever seen a result with the findings showing that environmental contamination is greatly reduced.